This is the Horizon OP-106 subgroup analysis of the melflufen plus dexamethasone in patients with relapsed and refractory multiple myeloma. And we particularly wanted to look at the adverse events related to hospitalizations that occurred in this study. So as we know, melflufen is a first-in-class peptide drug conjugate that targets aminopeptidases and releases alkylators into tumor cells. What we wanted to look at is in patients treated on this study, what was the healthcare resource utilization rates for patients with relapsed and refractory multiple myeloma treated on the Horizon protocol. The main reason for this analysis is that patients with relapsed refractory myeloma are a very sick population because of disease symptoms, comorbidities, side effects from treatments, etc. And patients with in patients with relapsed refractory multiple myeloma, adverse events are quite common and they can have significant impact on quality of life. So in this phase 2 Horizon study, melflufen plus dexamethasone showed a clinically meaningful efficacy and safety profile in patients with relapsed refractory multiple myeloma. The overall response rate of this combination was very promising in a heavily pretreated population at 29%. And the most common grade 3 or 4 greater treatment emergent adverse events included thrombocytopenia, and there were some SAEs reported, mainly pneumonia and febrile neutropenia. So we wanted to dig in further into this subgroup of patients and see what the actual rates of hospitalizations were. So of the 157 patients that were enrolled in this study, 35 of them were hospitalized due to a treatment-related adverse events. This was 22% of the study population. And when we looked at patients that were hospitalized, they represented the overall cohort in terms of their baseline demographics, and notably a lot of patients in this particular study had high-risk disease with high-risk cytogenetics and also extramedullary disease as been previously reported. So looking further into these patients that were hospitalized, the most common treatment-related adverse